Welcome back to The Ed Show. This is a big day for President Obama and the progressive movement in this country. But it would have never happened if it had not been for the Speaker of the House at the time, who never gave up. Democratic leader Nancy Pelosi sat down with me for an exclusive interview just hours after the ruling today. I asked her if she feels vindicated after fighting so hard for reform.
Well, I don't know if vindicated is the word. I'm really very, very happy. I always knew, I always thought that this would be upheld. This is about, people said, people suffered because, politically because of this vote. I think the election of 2010 was about 9.5% unemployment. $200 million was spent misrepresenting what the health care bill. 9.5% unemployment is hard to get through that shield to explain anything. But our members felt proud of what they did. We feel that we stand there in the ranks of those who passed Social Security, Medicare, and now health care for all Americans as a right, not a privilege. So we came to do a job, and now we're glad that the court upholds it.
There's a lot of Americans out there that stood with you on health care. They're not in the Congress today. Mm-hmm. The Tea Party ran against them. The Tea Party went after them on this health care bill. What do you say to them? Was that a courageous vote?
They stood very strong, and I've heard from most of them today. After the election, when we met, they said, I would never reverse my vote on health care for any reason. That's what I came there to do.
What are the next 4 months going to be like running into the election? Mr. Boehner just said over in this other press conference that the American people are going to have to decide whether they want this or not.
I think the decision has been made. The more people who are taking advantage of the health care reform, that is, some of the provisions that are already in effect, know how important it is to them, whether it's pre-existing conditions, staying on your parents' plan, whether it's lower cost of drugs, prescription drugs for seniors, those kinds of issues. And the more people know what it means to them, the more popular the bill will be, just, no matter what the other side says.
But listening to Mitt Romney today, he's clearly going to run against this. Is this a political winner?
I think, listening to Mitt Romney today, I was confused, because it was as if he was for it before he was against it, and now he is both. He supports the decision of the court to overturn the entire bill, and yet he said, but if they do that, you still cannot be discriminated on the basis of pre-existing medical condition. How does that happen?
Yeah.
Is he going to pay for it? Maybe he's volunteering, but the fact is you cannot have it both ways.
President Obama said today that this is going to reduce costs. President Obama said today that this is going to save the country money.
That's right.
In the other room, the Republicans are saying that, no, this is going to blow up the deficit. Mm-hmm. And the CBO scores it as a financial winner over the long haul. Who's telling the truth?
Well, first of all, when we did the bill, one of the main purposes of the bill, in addition to the right of people to have access to health care, the cost of health care in our country was totally unsustainable for individuals, for families, for businesses, large and small, for governments, state, local, and federal budgets, and for our economy, because the health care costs are a competitiveness issue. So that lowering cost was an essential part of how we went down this path. But also it has built into it studies from the Institute of Medicine, et cetera, to say we have to make choices in care that are about volume, not about volume, but about value, not volume, quality, not quantity of procedures, addressing regional disparities, all of that technical, but nonetheless substantial in terms of cost.
But they say it's not cost efficient, and they're going to run on that.
Well, you know what? We'll just have to have that debate, because what they want is insurance companies to have their way. I mean, this is what it is. You have a combination of the health insurance industry and the anti-government ideologues who go out there and fight against this bill. What they want is for the insurance companies had a good gig, huh? They can charge anything, ever increase the cost. You get sick, you use your policy, and then if you could even have your policy rescinded on the way to the operating room.
So they've spent a lot of money telling the American people that this is not good, and the next 4 months is going to be important messaging to the American people that this is good.
Yes, but I think elections are always about jobs. They're always about jobs. So that's really what the debate will be.
Well, they call it a job killer.
It creates 4 million jobs. Health insurance, health care is the fastest growing entity in our economy.
So it's not a job killer.
It's not. It creates 4 million jobs. It reduces the deficit. It lowers costs to individuals. It improves quality and expands coverage.
Your thoughts on Chief Justice Roberts' decision?
Chief Justice Roberts' decision, I believe, is consistent with his writings and his pronouncements in the past about the extent of the Supreme Court's role in passing on constitutionality. Mm-hmm. That's why I always said 6-3. I anticipated we could possibly get Kennedy, but I was wrong. But we did win, and I was right on that.
You had a very emotional phone call this morning with Vicki Kennedy?
I did. I called Vicki as soon as we knew to make sure, because I didn't know she had the TV on her way. And I called Vicki and I said, thank you, congratulations. And she was saying the same thing back to me. And I said to her, I said, we all know that this would not have happened without Teddy. It was his life's work. It was called the great unfinished business of our society, of our country. Now, finally, Teddy, as far as healthcare is concerned, can rest in peace.
But how do you feel that you're going to be remembered as the speaker that went back in and saved it? I remember a conversation I had with Robert Gibbs. He says, we're not going to get health care. And a few days later, you went in and revived it.
It was never a thought in my mind that we wouldn't have it. I didn't care what anybody else had to say about it.
You were going to do it.
We were going to do it. We had the urgency, we had the value, we had the votes, and we were going to make it happen. Some of the, one of these days in a longer conversation, we can talk about those who wanted to wait till we could get 60 votes, and I was saying, I'm going 51.
Finally, is this Kennedy-like? Didn't get everything, but you got a, you got a great start, and you got some great things, and that was kind of his philosophy. Take what you can get and move it forward.
Oh, well, we got much more than that. We got much more than that. Yes, Teddy was a person who said, you have to see a victory and recognize it when it is in sight. I wanted to have a bill that accomplished the same things as a single payer or a public option would do, even if we couldn't get the votes in the Senate to do the public option. And I believe we did that. I think we would have saved more money if we had the public option, and I think that our purposes are served by this, and if it enabled us to go forward, then so be it. One of these days, I do still believe that the decision, the judgment will be made, maybe by states, about their doing single payer on their own and the rest. But in the meantime, as far as meeting the needs of individuals and families, we're there. And as I keep saying, as far as our families are concerned, the best is yet to come.
Coming up, the witch hunt by Republican Congressman Darrell Issa came to a ridiculous political peak today. Congressman Keith Ellison of Minnesota joins me. And also, Congressman Mike Pence compared today's health care ruling to 9/11. Karen Finney will weigh in on the Republican reaction. Stay tuned. We're right back.